Welcome to Ortho Eval Pal, where we help you build confidence in your orthopedic evaluation and management skills.
Hey, how's it going today? My name is Paul from Ortho Eval Pal, and this is Hattie. And the first thing I want to do is I want to thank Hattie for helping us out today. She's a great kid and has been having some knee pain for quite some time. We'll ask her a bunch of questions, but again, I always thank my patients for being guinea pigs and for demonstrating, because I think it's really the best way to learn. We can talk about, demonstrations on things. You can go through your book and they talk about certain special tests and whatnot, but it's not like, seeing the real deal. And so Hattie's been more than generous to help us out this fine morning. She didn't need to get up this early, but she did just to help us. So thanks again, Hattie. So first question to you is, how long have your knees been bothering you? Because it's both knees, correct?
Yes.
Okay.
It's been a couple of years now.
Okay.
Yeah.
Now, do you remember anything in particular that you did that started your knee problem, or did this just kind of progressively get worse over time?
It just progressively got worse.
Yeah. Okay. So do you play any sports?
Yes, I play soccer, basketball, and softball.
And softball. So, 3-sport athletes. In northern Maine, that's pretty much what everybody does, because the seasons are so short. Everybody is a 3-sport athlete, which is a little bit tougher on joints than 1-sport athletes, or just playing one sport. So, does one knee bother you more than the other?
My right knee does bother me more, but they're pretty much both bothering me.
Now, do you have pain all the time? Is it during the activity, or is it more after the activity?
During.
During the activity? Okay. What do you do to help control your pain?
Well, I usually will ice my knee after. Nothing really, because I don't really.
Okay. What about things like squatting, kneeling, or doing stairs? Does that seem to agitate it?
Not really. Squatting sometimes, but.
Okay. Put a finger on where it hurts the most.
Like down here.
Right across the front. Okay. Both sides, or
Yeah.
mostly the right?
Both sides.
Okay. And so I guess what we're going to do now is we're going to talk a little bit about what Hattie has. I will tell you right off that she has Osgood Schlatters. Okay. And I'll go into a little bit of an evaluation of some patellofemoral dysfunction along with the Osgood Schlatters, but the most common finding is that you see this in teenagers who are super active. You never see this in couch potatoes, okay? Because what happens is the quad is pulling so hard on the tibial tubercle, and here's where the growth plate is. So the more the quad tendon pulls on those soft new growing bone cells, the more it kind of grows out. So just like if I were to take the skin on my arm and pull on it, pull on it, pull on it, pull on it like this, over time it'll start to harden like that and cause an exostosis or a bony spur right at the tibial tubercle, and then they become painful. So the other thing that we find is that these folks don't generally have effusion in the knee, or they don't have any synovitis, so her knees are not hot. She has full range of motion. One of the things I do want you to look at, though, is her standing posture. So that's going to be our first part of the evaluation. So Hattie, you could stand right over here with your feet right about there. And I don't want you to move your feet from that position, okay? So the first thing we notice is that she has this tremendously high tibial varum, all right? That's going to put her at high risk of shin splints, because her feet are going to want to collapse, and as they do that, the soleus, the deep soleus, and posterior tibial tendon muscles, posterior tibial muscles are going to work really hard to help support her arches, all right? Notice that we're going to take this index finger and we're going to put it on the front of your hip right there. And if we make a line from her finger to the center of her kneecap, okay, to where it attaches right over here, we have this high angle, and that's called the Q angle. Hers is higher than most. That puts her at high risk of kneecap tracking problems. The other thing that happens is her tibial tendon is pulling with a bend in it. And so we have an abnormal amount of pull at the tibial tubercle as a result of this high Q angle, all right? Now, this is something I like to do with a lot of folks, is a functional squat. Now watch what she does, and I don't want you to spread your feet apart, because I know that's what you want to do, okay? But I want you to demonstrate a functional squat, and I want you to do it once, and then we'll do it again slowly, and we'll talk about it a little bit, okay? So go ahead and do a squat for me, and back up. So I notice she wants to fall back. All right, so she does not have great flexibility in her calves. and she wants to turn her feet out. So let's do it so that it's comfortable for you. So you do it however you'd like, okay? And watch the feet. Go ahead and squat for me, and back up. She has a tendency to want to turn her feet out also as a result. So that tells us that she's a little tight. We know she's very tight in the hamstrings, very tight in the IT band, and very tight in the calves, and those all are contributors. All right. So I'm going to have you hop up on the table, and I'm going to lie right down on your back with your head on the pillow. So if we take a peek here, first thing I'm going to do is I'm going to ask her to tighten her quad muscles. She has an excellent quad. Tighten up this one. Very good. So I always look for suppression. You know, is she tightening it, or is it kind of sloppy and soft? If we take a look at this Q angle, okay, finger over here, okay, and we look at this line that comes down to the center of her kneecap, her tibial tubercle, she's attaching here. So tighten up your muscle, and I kind of feel where the patella tendon is landing, and rest. Again. It is way out here, so relax. The center of her kneecap is here, and it's way out there. So imagine this line. See this angle? It's super huge. So she's getting this abnormal pull here along with this tibial varum. So first thing we tell her is that, you know, you've been given what you've been given, which are these kind of crooked legs. Okay, it's just a little, you know, bend in your legs, but it's not a big deal. You're going to be able to continue to play sports and do everything that you like to do. All right. But how do we take care of this? Okay, so one of the things I want to do is I just kind of want to go through, and we'll be able to edit all this, don't worry about it. So what we're going to do is we're going to go through and just do a brush test to see if she has any effusion in there, and she does not. Okay, and we're just going to do it on this leg for now. She has no instability medially. Laterally, she's good. She has a negative Lockman test. She has a nice endpoint there. Okay, range of motion is nice with full flexion, full extension. So this is really hurting when you're using it a lot, correct? Okay, let's check her hamstring flexibility. Oh, that's not grand. And then if we pull you here, we're quite tight also. Okay, so tight hamstrings, I'd really like to see her, you know, around 80 to 90 degrees of straight leg raise with hip mobility there. And we're going to do an Ober test next. So I'm going to have you turn on your side. You're going to face that way. Okay, and I want you to take this knee and I want you to pull that up to your chest, hold on to it. And I'm going to take this leg out here. I'm going to push her head a little bit. And what we're going to do is we're just going to let this knee drop. Okay, and notice it should really fall right down to the table, and it does not. And it's not doing that because her IT band here is way too tight. One of the problems with a tight IT band is that it has fibers that attach to the lateral side of the kneecap that pull the kneecap outward also. So we can end up with a little bit of patellofemoral dysfunction as a result. So I'm going to have you go ahead and roll onto your back again. Okay, good. No problems with any of that stuff. I'm going to poke around a little bit. Any pain there?
Right there.
Right there. So I'm right on the tibial tubercle. You don't like that either, do you? And that's very tender. Okay. So she has signs of Osgood Schlatters. She occasionally has some kneecap pain, okay, and she complains of her pain as being supralateral on both sides, which is the most common area to have patellofemoral dysfunction. And we'll be doing a segment just on patellofemoral dysfunction soon. So I'm going to have you go ahead and sit right up. And so what do we do with Hattie? If you were to see this patient in your office, you obviously know she doesn't have a big effusion in her knee. She doesn't have any significant instability. She doesn't look like she has an ACL tear, meniscus tear. She's had no mechanism of injury. This is basically an overuse injury. And so what do we do with that? Well, relatively rest you, okay, is going to be important. So what does that mean? Doesn't mean like 6 weeks of bed rest. It does mean, though, that you should try to avoid activities such as kneeling, which put a lot of pressure on there, and activities like deep squatting, which really stress this tendon. I'd also like to see you kind of lightening up on the quick acceleration and deceleration activities, because that stresses the patella tendon and the tibial tubercle quite hard. Wearing a knee pad on both sides, like a volleyball knee pad, could be something that you might want to do when you're playing sports, because every time you get knocked here, it's going to really inflame that spot, It's going to hurt, and it's going to hurt for quite a while. If you're having pain, you can ice this, no problem there. And as far as primary care goes, a non-steroidal anti-inflammatory can be helpful and to decrease inflammation, but I usually will talk to a pediatrician and or the primary care provider about prescribing that to help things settle down a little bit. So this is a pain-limiting problem. That means if it hurts, you should slow down. The problem is that if you continue to push really, really hard, and I've told you and your mom this, that this bone growth can continue to get bigger and bigger and bigger, okay, if you don't kind of rest it up a little bit. And as a result, we'll develop a large spur. And I see these people when they are older, and they have these big spurs, and they can never kneel on a hard surface. So she's young, you're what, 13?
14.
14 years old, and so you're young, you have a lot of time ahead of you, you're a great athlete, and I think you're going to continue to do well, but in this transition here where your bones are growing and developing, I might recommend kind of slowing down a little bit, okay? And so we've talked about how to modify that, but still keep her active. So what we're going to do is we're going to throw a couple of our special tests on our website at www.orthoevalpal.com, and feel free to get some of our checklists on there also. And so we'll have PDFs of common subjective questions to ask people with patellofemoral dysfunction and Osgood Schlatters. We'll talk about common recommendations and treatments for it, and we'll go through some of the objective testing so that you have something to work with. Ultimately, we're going to turn this into a course that you can come and watch, and we'll have some interaction. And please feel free to send me questions my way, answer some of my blogs, and I will do my best to get back to you with that. Thanks.
We hope you've enjoyed this video, and for more awesome content, go to orthoevalpal.com. Can't wait to see you there.